Yeah, it attacks the central nervous system. Anything can happen. You can, go numb in half your body. You can lose vision in an eye, or you can not be able to move. You can lose cognitive abilities, maybe memory. You can just be walking down the street and fall down. So you don't ever know what's going to happen. And I think that's the part that is so devastating about it, is you get this disease in your mind, just thinks, well, how is this going to manifest for me? When I got the diagnosis, it was a really difficult time, and really relied on my meditation practice and the dharma and the sangha to really pull me through. And I think it was a really dark and difficult experience, but with my practice I was able to really feel that sadness and the grief that comes with a diagnosis like that, and just to have that space and hold it and know that there was room and that things would change. One of the main things with MS is you have what's called an attack, and it's when your immune system is attacking your nervous system. And when you have an attack, depending on where you have it, it will manifest in a symptom or some type of issue. And one of the main factors in having an attack is stress. As with a lot of health issues, stress is a trigger for a lot of things, and especially with MS. And I know for myself, it's a trigger to have an attack. And so the process of meditating helps bring some peace and some calmness. And I think you practice finding space inside. You have a feeling of fear or anger or hurt or sadness or maybe physical pain. And instead of, you allow that sensation to be there, but you're finding a little bit of space. You have to take these medications, which are, have side effects that, aren't so great, and, just being present and trying not to push against the pain or the fear. That's a practice that you exercise when you're meditating. It's like a muscle that you kind of get into use, and then it strengthens. So I think without that practice, I don't really know where I'd be right now. And I think that it's helped me to move through the diagnosis, but also to realize that in this moment, I still have everything that I want. I can still walk, I can still breathe. I haven't actually lost anything now. And so it's helped me to, deal with the fear and the grief, but also to be able to look forward to, the present moment as it is, and to just try to accept things as they come. For me, and the reason I'm doing this video, is I don't know where I would be right now if I didn't have this practice. And I think about people who don't have this practice and how much it's benefited me, and how I've been able to really move through this grief, this process of grief, this very devastating diagnosis, and turn the corner. It was terrible. It was bad news and sad, and I didn't want to go on. I didn't want to keep living, and that's a thing that happens with a lot of people with MS is, they have a 7 times the normal rate of suicide. It's a, it's a very scary thing. You don't know what's going to happen. You don't know what the future holds. And if you don't hold yourself with some type of care, some type of space, and give yourself a little bit of nurturing and peace, how can you have a better outcome? So I think that, the drugs that they prescribe are great, and we're so lucky to have them, especially now, and hopefully someday there'll be a cure. But until that happens, I'm going to do everything that I can to heal myself on every possible level that I can.